Welcome back. My name is Dr. Carl Baird, and today I'll be discussing the number one cause of joint pain in adults as they get older. So this cause can be used to explain all sorts of joint pain, whether it's your lower back, your hips, your knees, your ankles, your shoulders. This cause can be traced back to really pain anywhere in the body. And what's really important about understanding this concept is that the sooner we understand this root cause, the sooner we can get started on solutions and things that are going to help you keep active and maintain your lifestyle as you get older. So before we get into it, I want to get crystal clear on the type of joint pain that we're describing, because there are different types. This is for that joint pain that seems to just gradually come on. There's not one specific incident that kind of started all of this joint pain. It's more, I just woke up one day and my back pain got worse. And it's the kind that in the back of your head where, well, maybe I'm just getting older. And the older I get, the more frequent this pain becomes or the more intense it becomes. But you can't seem to pin it back to a certain cause. This is by far one of the most common types of joint pain that I treat in my clinic. And it causes all sorts of frustrations and headaches because a lot of people have tried all sorts of therapies and they may have found temporary relief, but they haven't found that long-term outcome that they're looking for. And so by tracing it back to this one cause, we'll be able to get started on solutions, again, to keep you active and helping you maintain your lifestyle as you get older. All right, so the number one cause of joint pain in adults as they get older is what I like to call impact. Too much impact on your joints over too long a period of time. And so this is where people start to get confused because there's not that one obvious incident that's causing your pain. It wasn't a car crash. It wasn't a fall down the stairs where the cause is obvious. These are smaller impacts that get accumulated over time until your joints finally get to a point where they can't take it anymore. And they create the signal, hey, there's pain here in my knee. We should stop using this knee to rest it. And so if we want to solve this joint pain, we have to look at ways to limit the impact that goes through your joints. So let's get started by talking about what causes, again, these smaller impacts that accumulate over time. And they come back down to three things. One is movement patterns or movement coordination. How do you coordinate movements to do certain things, to bend over, to sit down, to hinge, to lift, to squat? These are small impacts or small movements that if we don't do them correctly lead to more impact on your joints. The more frequently you do them or the heavier weights that you do, the more intense or more frequent your pain becomes. So that's number one, is movement patterns. Number two is mobility. So this is your actual range of motion of your joints. What you'll start to notice is this isn't true for everybody, but a lot of people, as you start to get older, you just get stiffer and you can't bend down quite as far. There's not as much range of motion in your hips. And this can lead to movement compensations that put the small impact on your joints that start to get worse over time. And the third, and by far the most important, is strength. Your body has to be strong enough to do the activities that you love. And if your body isn't strong enough, instead of your muscles taking all of this impact through the day, that impact goes through your joints. And over time, that's going to lead to back pain, knee pain, hip pain, wherever you're experiencing it. It shows up in different people and different places. But if you're not strong enough and you're not moving well enough, that's where this impact is gradually going to add up and lead to this pain that we associate with getting older. So why hasn't anybody brought this up to you before? If you're suffering from this chronic joint pain that kind of has been coming and going for years, you've probably been to your doctor, you've probably seen a chiropractor, you've probably seen a physical therapist, massage therapist, acupuncture, whatever it is. But nobody's brought up the importance of learning to limit impact on your joints as a way to solve joint pain, keep active, and maintain your lifestyle as you get older. And the simple reality is because there's not one treatment that can help you limit impact. You can't just take a pill. There's no injection. There's no adjustment. There's no massage technique that can teach you to limit impact as you go throughout your day. The only way to limit impact that goes through your joints is by improving movement and building strength. And these are things that, one, you have to be taught by somebody who understands how the body moves, and it takes time and it takes consistency to get to the point where there's less impact going on your joints so that you're able to do whatever it is that you love to do. And unfortunately, in the traditional medical system, time is something that not a lot of doctors have. And so what they often do is just give you a pill, something to manage the symptoms without addressing these underlying causes, which leads, again, short-term relief without these long-term outcomes that we're looking for. So that gets us to our last point of what is the best treatment for this joint pain that adults start to experience as they get older. And that goes back to treating the root causes that we talked about earlier. And this is what I really try to do with this channel. One is improve movement quality, how you coordinate your movements to limit impact on your joints. So this is things like the hinge, the lift, the squat, the lunge. These are all important movements we use not only to build strength, but you use throughout your day. And the better you are at learning, understanding, and practicing these movements, the better you're going to feel through your day. So one, we have to learn to improve our movement quality. Two, we have to improve mobility. We have to make sure that our joints have enough range of motion so that we don't end up compensating a lot of these movements, which puts pressure on places like your low back and your knees are by far one of the more common areas that this kind of pain associated with getting older shows up. And the last, and obviously what I feel is the most important, is building strength. The name of the channel is Solving Pain with Strength, and what I really want to help people do is help build strength without stressing your joints. If your body is strong enough to do the things that you want to do, that means your muscles are handling most of this impact, which is what we want, and less impact is going through your joints. So the better you move, the stronger you are, the less impact that's going to go through your joints, the better you're going to feel as you get older, the more you're going to be able to keep doing all those things that you love as you start to get older. So that's all I got for you today. Again, my name is Dr. Carl Baird. This is Solving Pain with Strength. I hope this video helps you understand what has been causing this pain that kind of comes and goes and helps you get started on the right path. Thank you so much for watching. If you haven't already, subscribe to the channel for more helpful information. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.